Welcome to today's talk, Public Policy and Policy Advocacy for the EMS Provider. So a couple things straight off the bat. Why would we ever study policy? Why do we ever care about public policy? Well, a few different reasons. We got scientific, professional, and political reasons. On the scientific side, well, how is policy made? What goes into public policy making? Those are very important things to understand. More important for the general EMS provider, for us out in the field or at the desk there at your EMS organization. Are those professional reasons? You know what? We need to know when policies are implemented from above, well, how do they impact us? And how do we analyze these policies? Are they working or aren't they working? And then how do we define working? How do we define if they're working or aren't they working? So how do we analyze these policies? And then on the political side, as we move up into those desk positions, you know what? We can't throw away those political factors. So how do we influence the system? We are passionate about something. There's something that we care about. We want to push forward. So how do we push forward our passions, and how do we influence our political arena? Second big thing here is, what's a point for me as an EMS provider? What do I care? Well, we want you to be a consumer of policy. We want you to be a designer of policy. You're passionate about something. Let's design good policy to push forward. And then finally, we want you to be an advocate for good policy. We need to understand that policy itself, public policy, health policy itself, is multifaceted. It is interdisciplinary, just as a subject. So, how does policy impact our citizens' health? How does it impact your patient's health? We can look at public goods such as roads. We can look at natural resources such as clean water. Mandates. We've got an example of seat belts is a great safety mandate that impacts citizen health, direct support such as just money, just funds, and how do we elicit those funds, and then opportunities, incentives. Education is a great incentive. Education is a great opportunity that impacts people's health, impacts population health. So let's get into some nuts and bolts of the policy process, public policy process, and there's this stages model of public policy process. How do we get an idea into policy and into maybe legislation? If we're looking at a macro level, maybe organizational policy if we're looking at a micro level. So first is just this problem identification. So we need to identify a problem, and this problem is defined by you, defined by me, defined by just anyone. What do you see as a problem? The next step is to make it into an issue. So I might see something as a problem, but how do I get you to care about it as a problem? So it might be a problem to me, might not be a problem to you. So the next step, that second step, is we need to make it into an issue, coming from a problem that I see as a problem into an issue that we can sell to a wider audience. Next, we need to get it onto an agenda, and this is kind of the next step where we're moving up the ladder. So getting it into our administrative agenda, getting into a legislative agenda, whatever that agenda may be. I've defined it as a problem, I've made you care, and now it's on an agenda that we can do something about it, that we can talk about it at least. Next step is this policy formulation. So I've got this problem, it's on our agenda, we're talking about it. Well, what are the options that we can choose from? So we've got a problem, and now we've got a potential solution to that problem. So we've got a primary solution. We might have one or two or three or multiple other options for this problem, but we've got a primary problem, we've got a secondary, maybe a tertiary solution. So we've got this policy formulation. So I've got a policy that I want to put forward to solve this problem that I've sold to you. Now we can adopt this policy. It's pretty straightforward. I've got a problem, I've got a solution, let's implement it. So I've got this policy implementation. Once we implement it, we usually lasts a year, maybe 2 years, maybe 5 years, maybe 10 years, depending on the issue, depending on the solution, the policy itself. We're implementing it, and then as we are implementing it, and after we implement it, we can evaluate it, and as we evaluate, we can um, we can tweak things. So maybe we've got a problem, I've got a policy, we've implemented it, we've evaluated it, didn't do exactly what we thought we would do, so we can tweak things, and then we start the process all over again. So even though we're going left to right here, this is really a cyclical process where we've identified a problem, we go all the way through implementation and evaluation. Well, once we go through evaluation, we might have another problem, and with that problem, we can implement another policy or a tweaked policy. Now, this is very linear, and the real world isn't always linear. It's very rarely linear. So, how does public policy, how do our policies really happen? How do they, how do they come across? How do they develop? Well, there are a number of models, a number of theories. There are dozens and dozens and dozens of them, but I'd like to highlight just a big few. The first is that of punctuated equilibrium. This comes from Frank Baumgartner and Brian Jones. They teamed up, and this was a kind of flying in the face of incrementalism. So they said incrementalism policies develop very slowly over time, not a whole lot of change, and things just develop to the point where it's just status quo. They said, you know what, that doesn't always happen. So this punctuated equilibrium, they said in public policy, there are these long periods of policy stability, and they are, quote unquote, punctuated by these very short bursts, this radical change. So long-term stability, and it's punctuated by huge change, radical change. And with this, you know what? Let's look at automotive safety. And with automotive safety, well, you know what? Safety first, except if you were living in the 1950s, right? So here we've got children just kind of leisurely riding in these automobiles. You don't see any airbags, you don't see any crumple zones, you don't see any seat belts, you don't see any headrests. And this went on for decades and decades and decades. Automotive safety regulations, policies were just, there's a car, it's driving down the road, and no big deal. Until you got into the 1960s, 1970s, we started seeing seatbelts mandated. We started seeing safety features mandated, started seeing headrests mandated. Coming into the 80s and 90s, you see airbags mandated, crumple zones mandated. So long periods of policy stability. And then think back to the 1966 white paper for EMS with traffic deaths. And that's a punctuated equilibrium. Suddenly things changed in the 1960s. Another big theory model of policy generation is John Kingdon and his streams model. So we've got three streams: a problem stream, a politics stream, and a policy stream. Each one of these exists in its own right. So we have a problem, and that continues on over time. We can define a problem over time. We've got a politics stream that develops over time. We have a policy stream. So perhaps we have a problem, and to that problem we have this policy stream. We have a solution to this problem, or a potential solution to this problem. Well, there's also a politics stream, and when all these converge, we have this window of opportunity. So our problem, our politics, and our policy streams all converge, and we've got this window of opportunity, and within that window is our opportunity to act. A wonderful example of this is the Patient Protection and Affordable Care Act, passed a little over a decade ago, or the ACA or Obamacare. So we've been talking about health insurance and healthcare policy for years and years and years and decades, and every time there's been a presidential election, those debates, there's usually talk of healthcare and health insurance policy, but none of it ever comes to fruition. So in 2008, 2007, 2008, 2009, we saw these streams converge, this problem, the politics, and the policy, and we got the ACA. The last model I want to highlight is that of Tom Birkeland's and focusing events. I was a student of Birkeland, so of course I'm going to think that he is his model is very important, but in the context of emergency medicine, EMS, I think this is really, really important. So what Birkeland said was there are these events that are very sudden, pretty uncommon, fairly rare. So he's taking Kingdon's streams model and just compressing it into a single event. This very sudden, this very uncommon, rare event. This event is harmful, and it's kind of this call to action. So this uncommon, rare event makes us focus on a very singular policy or policy issue and tells us, hey, we need to do something. And then all of our attention is now on this very singular issue. Case in point is the 9/11 attacks, this focusing event. So Birkeland really highlighted 9/11, looked at Hurricane Katrina, looked at the BP oil spills down in the Gulf of Mexico, these very uncommon, rare events, one-time events. But these events elicit a very visceral response from the citizenry, and tells us we need to do something about this, and focuses on a very specific policy issue. All right, so those are the bare bones, nuts and bolts of policy and policy making. But you know what? What is your role? What is your role as an EMS provider in this policy environment? Well, first is that of issue definition. What's the problem? And how do you define that problem? And how do you make us care about your problem? The second are policy ideas. Well, you've defined a problem, and we can't present a problem without some sort of solution. So what is your solution to that problem? Give us some ideas, push your ideas. And that goes into the third, which is advocacy. We want you to be a policy advocate. There's a problem. You have a solution or a potential solution, or maybe 4 potential solutions. Well, be an advocate for that. Be an advocate for that problem. Push that problem. Tell your story. Push your ideas, and just be an advocate for that policy. Nothing is going to change without advocacy. And with those 3, I want you to be very, very mindful of framing, what we're going to call framing, and that's just you telling your story. So how do you tell your story is framing. We can tell our story in a very boring way, or we can tell our story in a very emotional, get onto my team way. So frame your story, tell your story, and really the core elements of framing your story are 2 things. So who benefits and who pays. So we're advocating for a policy. Who's going to benefit from that policy? And what is that impact going to be? So is it going to be a micro? Is it going to be macro? Are the beneficiaries going to be just the people on your block? Or are the beneficiaries going to be those in your state? So who is going to benefit? How wide-ranging are the benefits going to be distributed? And then who pays? And again, where's the distribution going to be? Are just a few people going to pay? Is everyone going to pay a little bit into this policy? Because when we enact a policy, someone's going to have to pay for it. We're going to have to pay for it somehow. So who is going to pay? How much are they going to pay? And how widely distributed are those funds going to come? So we've asked you to be an advocate. How do you be an advocate? So when we're thinking about policy, think about our ideas. How do we go about advocacy? Well, what are you passionate about? If you're not passionate about it, you're not going to be a good advocate. So you really have to be passionate about a certain issue, certain idea, and just know that everything can be changed. Every policy can be changed. Every situation can be changed. Some are more difficult than others, but everything can be changed. So what are you passionate about, and what do you want to change? To be a good advocate, you need to do three things. First, you need to understand. You need to understand the issue, the problem, and you need to understand the policy. So if you're not making the policy, if you're not recommending the policy, any policies coming forward, you need to understand the policies. Second, you need to consume. So policy briefs are very short synopses of recommended policies, and policy analyses. These come after the policy is enacted. So we've got pre, we've got post. So you need to understand the policy, then we need to consume policy briefs, which give us an idea of what the policy should be doing, needs to be doing, its intent. The policy analysis on the back end is we've enacted this policy, and has it done what we want it to do? What is the outcome of that policy? And then we need to share. We need to push it out to those who aren't policy advocates, those who don't fully understand the issue, the policy, those who don't fully consume policy briefs, those who don't fully consume policy analyses. We need to share it and scream it from the tower. So let's take these and break them out one at a time. First, let's understand. So let's understand the issue. Let's understand why it's an issue. Why is it a problem? Let's understand how it's a problem. So how is it an issue? How does it impact me? How does it impact the greater populace? And then who is this an issue to? To whom is this an issue? Who does this impact? Within our understanding, we need to understand both outputs and outcomes. So two very different and separate concepts. Our outputs are short-term, our outcomes are long-term. So outputs are very easily measurable. They're typically short-term. If we think of the education arena, educational policy, let's think of test scores. Maybe your children, maybe you have taken a standardized test, let's say SATs or ACTs. Well, what do those test scores mean? Our outputs in the short term, we can increase test scores, but what does that mean long term? Those long term are our outcomes. Typically, there's a little bit harder to measure, so if I increase ACT or SAT scores, what does that mean on the quality of education? What does that mean on quality of life? So short term, we're looking at outputs and very easily measurable maybe scores here. And the outcomes, longer term and more quality of life. In this case, quality of education. In EMS and healthcare, maybe quality of health. Our second point is that we need to consume policy and public policy information. So we can look towards our health policy journals. There are a number of policy journals, but if we want to focus on health policy journals, here are a few for you. Health Policy, Milbank Quarterly, Health Affairs. I would recommend Health Affairs. They've got an amazing blog that's updated just about every day. And they've got an email list where they will email you just about daily, every couple days, some big things happening in American health policy, the American health policy arena. Focusing down a little bit more from just a broad health policy into an emergency medicine an emergency policy standpoint, we've got a few journals. And well, we have a number of journals, but I want to point out a few here to you. Pre-hospital emergency care and pre-hospital disaster medicine are two big ones for the EMS world. But also want to point out American Journal of Emergency Medicine and Academic Emergency Medicine. Both publish pre-hospital research, and we can look to these for some policy ideas. These aren't necessarily policy journals, but we can look to these for policy ideas and current research in the pre-hospital and emergency medicine environment. If you're looking for current trends in EMS, we can look towards EMS World magazine and GEMS magazine, bearing in mind that neither of these are peer-reviewed. They are trade magazines. But if you're looking for just current trends in the industry and up-and-coming issues, we can look towards these couple of magazines. They're both online and in print. The third thing we want you to do is to share. So scream it from on that tower. We want you to frame your story. So make us care. You may be passionate about something. Well, make us care. Make us passionate about it. And with that, we need to appreciate these political factors. There are political factors, whether we're at an organizational level with administration, whether we're at a county level, a state level, or a national level. We really need to appreciate the political factors as we are framing our story, and we need to change the frame of our story to fit our audience. So if I am selling my issue, my story to my neighbor, that's going to be very different than if I'm trying to sell that to my state senator. It's going to be very different than if I'm trying to sell that to my director. And as we share, or as we look to share, as we look to push forward, we need to find partners. We can't do this alone. We can never do this alone. So who are our health advocacy groups, our private groups, who can help us, who we can help push forward these policy ideas, these problems, who are our political partners, maybe state senators, state representatives, if you even want to go further into Congress. So who are our legal legislative partners, and who are your local or even not so local university partners? So universities, colleges are a wonderful source, an amazing source of advocacy partners, and a great source of expertise, and a way to push your agenda forward and your policy ideas and your issues forward. Now we've gone all this way. We've gone through advocacy. You should be an advocate. You should be a consumer. You know what? But so what? Who cares? What is it? What is it to me? Well, there are a lot of things to you. So, there are these position statements coming out from our national organizations. Position statements on degree requirements. That's going to be policy. That is going to be public policy, whether at a national level, a state level, or a local level. That's going to be policy. So you have a voice in this. What do you think? What do you care? Your voice is needed. Your voice is valuable. And do you support it? Do you not support it? Whether or not, you need to make your voice known. Another is this ET3 model. This is coming out, right? Pilot programs are being developed starting January 1. This is a policy. This is a federal policy. And you know what? So what? Well, we need to care about this. We need a voice. And if our voices aren't heard, it's only going to be CMS, the Centers for Medicare and Medicaid Services. These people who aren't paramedics, these people who aren't in EMS, crafting these policies. Well, we need to be in there. We need to be part of that conversation. And I want to highlight one policy, one program policy that we implemented in Charlotte that was I was a part of was the McFuse, Mecklenburg Frequent User of Services. And so this FUSE program, we took frequent users of services, emergency services, the ER, EMS, jails. They were in and out of jail, central jail. They were in and out of homeless shelters, just frequent users of emergency services. So this FUSE program, this frequent user service engagement program is what FUSE stands for in Mecklenburg County. We took about 50 or so high frequency users of all of these services and gave them an apartment. We gave them an apartment, paid for an apartment, gave them social services. So we partnered with not only the sheriff's office, local EMS, hospitals, social services, local homeless shelters, partnered with all of them, gave them an apartment. Again, about 50 people or so was our pilot, and the results were amazing. This was a public policy. It was a problem. So we've got people using services, overusing services, abusing our services, right? So we always talk about abuse of our services. Well, what do we do about it? Well, let's do something about it. And we did. And the results were they did not use these services anymore. We saved so much public money that it was actually cheaper to pay for an apartment, get them signed up, and get them enrolled in public services. We saved so much money that this was cheaper. And that's amazing. And not only did we do that, but we increased their quality of life in a short amount of time. Most of these participants were fully employed and paying for the apartment on their own. So just a small investment, a relatively small investment, led to this amazing transformation in these people's lives. So think about your that public policy. Think about what is the problem. Think about what are your potential solutions to that problem. Think about your stakeholders. Who cares? Sell that issue. Sell that problem. Try to fix that problem, and see where it goes. To end this, what is your policy issue? What problem do you want to tackle? What problem do you think needs to be solved? And then instead of complaining about it, which is kind of the point of all of this, instead of complaining about it, tweeting, posting on Facebook, Instagram, Snapchat, what are we going to do about it? How are we going to do it? And what are going to be the outcomes? So to end this, just think, what is your policy issue?